The treatment of malignant skin tumors should also be considered depending on the nosological unit or the specific disease. Basal cell carcinoma of the skin, as a locally advanced tumor, is subject to surgical treatment. Sometimes for the treatment of small tumors, cryodestruction, laser destruction, or X-ray radiation may be used. For squamous cell carcinoma, it is necessary to use not only surgical treatment methods aimed at removing the primary tumor and metastases, but also, if possible, radiation therapy. And sometimes when lymph nodes or other organs are affected, chemotherapy must also be used as a treatment. When it comes to treating melanoma, melanoma treatment in general, it must be said, is the most challenging due to the often considerable unpredictability of the disease's course, as well as its resistance to radiation therapy and to the chemotherapy options currently available. Therefore, depending on the stage, the treatment strategy is developed as follows. In the early stages, it is sufficient to surgically remove the tumor. Sometimes it is necessary to perform a lymph node biopsy or lymph node dissection, the removal of lymph nodes in the affected area. Currently, there are ongoing discussions about biopsying affected lymph nodes, which are performed using special dyes or radiopharmaceuticals. The next step, when distant organs are significantly affected, is to consider the issue of systemic treatment. Systemic treatment of melanoma when distant organs are affected presents significant challenges because traditional chemotherapy is ineffective. Therefore, over the past 3 to 4 years, immunotherapy and targeted therapy have been proposed and are being actively introduced into clinical practice. These therapies are aimed specifically at the genetically altered tumor cell, which is the progenitor of the entire tumor. Nevertheless, surgery remains the main method of treating malignant skin tumors. Sometimes, because it is necessary to remove rather large volumes of skin and soft tissue, this method has to be supplemented with plastic surgery procedures, replacing the defect with transposed flaps, grafts or flaps on microsurgical anastomoses. The next type of treatment that we have been gradually introducing over the past several years is regional chemotherapy for malignant tumors of the skin and soft tissues. This involves carefully administering high doses of chemotherapeutic agents directly into major blood vessels to achieve the most effective impact on these tumors. To sum up this discussion, it is probably much better to focus not on the treatment of highly complex localizations, very large tumor volumes, or their metastases, but rather to raise the important issue of skin disease prevention. This prevention consists of the thorough and careful treatment of benign precancerous conditions, as well as the identification and elimination of factors that may eventually lead to tumor development. Most often, we are specifically talking about exposure to sunlight, so carefully limiting sunbathing, wearing appropriate protective clothing, using a good sunscreen, and also avoiding tanning beds altogether would be a very good and practical starting point in the ongoing fight against skin cancer and melanoma.